Hi, I'm Dr. Tracy Kettering. I am the director of our Applied Behavior Analysis Center of Excellence here at Bancroft. And
Hi, I'm Dr. Nikki Schwartz. I'm a clinical psychologist and the director of mental health services within Bancroft.
We are here to talk to you today about depression and other mental health concerns that may impact individuals with autism or other developmental disabilities right now due to the COVID pandemic, but really that may experience these concerns at any time. So to start us off, Nikki, can you give us an overview of the general symptoms of depression?
Sure. So just some general symptoms to look for when we're thinking about depression are some mood changes. So sadness, tearfulness. In children, we would look for irritability or crankiness. Some other symptoms would be a loss of interest in things that were once enjoyable, either weight gain or weight loss, sleeping more, sleeping less, some difficulty concentrating, paying attention, kind of things like that.
One of the things that makes this really hard to diagnose in individuals with autism and other developmental disabilities is that they might not be able to communicate things about how they feel. And so we have to rely on their behavior for diagnostic purposes. And the core symptoms of autism often overlap with symptoms of both depression, anxiety, and a lot of other mental health concerns that we see. So when we talk about sleep disturbances in depression, well, a very large proportion of individuals with autism and intellectual disabilities already experience disruptions in their sleep. Similarly, not being interested in certain activities or social interactions. Again, not for everyone, but sometimes those can be what symptoms look like in autism. And so I think when we talk about diagnosis or identification of these concerns in this population, we really have to talk about changes, like changes that we see in a person's behavior or presentation.
Right, absolutely. So for our individuals or the individuals we work with, it would be helpful to look for changes in sleep. So if somebody already had kind of dysregulated sleep or trouble sleeping, that wouldn't necessarily be a symptom or a sign of depression for that individual. But if they were sleeping now soundly through the night, every night and through the day, that might be something to look for. Or they're engaging in a new or unusual behavior that nobody's really seen before, or something that they've enjoyed doing, maybe watching a certain video on the iPad if they no longer have interest in doing that. So we really want to get individual changes, not necessarily such broad symptoms.
And that's a really good point, Nikki, because when we're talking about changes, we also have to be really mindful that the changes, even some of the changes that you're describing, could happen for other reasons too.
Mm-hmm.
For example, if an individual has a change in their medication and now they do have a change in their appetite, well, a lot of medications, a side effect is a change in their appetite.
Right.
Changes in appetite, changes in sleep, and even mood can be related to medications that they could be on.
Mm-hmm. Yep. So I think the first thing we can do is if one of these individuals, if they can communicate, we ask them, right? We kind of have the conversation with them and ask them how are they feeling, anything they want to talk about. Just see if we could relate to them and kind of find out where it's coming from, these changes.
And for a nonverbal individual, we have to look for these changes. That really means that in order for us to be effective at identifying these changes, we really have to know the person well.
Mm-hmm.
So we have to look for changes in their behavior from previous presentations and report that to someone. So I guess from a perspective of a take-home point for people, I guess our first point would be that if you're a parent or a caregiver and your child can communicate, then you should ask them regularly, especially right now during the pandemic, how they're feeling, and trying to get a gauge on how this is impacting them. And if you don't feel comfortable doing that, you should try to find someone else that does. Or if they don't feel comfortable talking to you, try to find somebody they do feel comfortable talking to.
Mm-hmm.
And then if you provide care or you're a caregiver for an individual that is nonverbal or that doesn't have the capability of reporting on their feelings, we need to be looking for changes in their behavior and then reporting them to a clinician. Because even if we were to observe a change in someone's behavior right now during this pandemic, would that necessarily mean that they would be, potentially diagnosed with depression?
Right. That's a great point. A lot of us throughout our lives kind of have mood changes, and sometimes we're sad and sometimes we're happy and sometimes we're irritable. So just keep that in mind too, that some of it is very normal and developmental and appropriate given the times. So we don't also want to just take a change in a behavior as, oh, they might be depressed, or, oh, they may have anxiety. We also need to put it into context and see what is
Yeah.
typical.
Yeah. I mean, so I assume, and correct me if I'm wrong, that a change in behavior right now is kind of expected. A child might be upset because they can't go to the park, or
Right.
be mad because they're doing schoolwork at home and they're not usually required to do schoolwork at home.
Right.
And those are obviously things to look out to and to monitor.
Absolutely. And I think
But
of us as well, like we're all getting a little stir crazy, right? Like we're all kind of trapped in our house and we can't do the things we normally do. We can't leave our house really, except for the necessities. We aren't having contact with individuals. Think about the people we serve right now. They can't see their family members and their loved ones. So that takes a lot of adjusting. And if they don't fully understand, I think we're absolutely going to see some behavioral changes.
yeah. And so the important thing would be that if you are providing care, whether you're a parent or a caregiver at a day program or a residential program or even at a school, that we should be looking for changes and then reporting them to either a clinician or someone that can report them to a clinician for us.
Absolutely. Yep. And then as a clinician or a prescriber, when you're having your big team meetings or your psych appointments or medication appointments, I think it would be helpful to ask the staff member or the direct support professional or whoever's with the person served, ask them these questions, because I think a lot of times they're more focused on the behaviors. So I think if we focus on some of the sleep questions or appetite questions, loss of interest, things like that, just to make sure that we are constantly monitoring.
Awesome.
Mhm.
Thank you.
Thank you.